pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Okay. Looking for public comment. Do we have public comment?
Announce Danielle.
Did everybody have a chance, and it sounds like you did, to look at the consent agenda?
Very nice, thank you.
Yes, I like that.
I so move we accept.
Can you hold on one second, please, before you, for some reason, my
Following up
phone
our timetable, Charlie.
did not want to work. Slide hold switch to activate. Now it goes. Thank you.
I so move that we accept the consent agenda. Second?
Been moved and seconded to approve the consent agenda as presented. All those in favor?
Aye.
Okay. Stepping right along, we got Ed with the financial report. Ed, your first chance up on the firing line.
All right. Well, good evening, and this is my first time through, so we'll try to
Set up for you. Shireen, sorry about the start date of June 4th. We just didn't think you wanted to miss the graduation. Tomorrow.
I called about that.
Okay, so the first thing to look at for the month of April 2021 is patient count. In acute in 2021, there's 356, which is an increase of 136 over the previous year. In clinics, there was 2,028, which is an increase of 769 over the previous year. Other outpatient services, there was 5,573, which is an increase of 3,227 over the previous year.
Can we keep that trend going, you think?
Yes. I don't know, so many
3,000% a month?
Every lobby's been busy this year. I know this month for sure. You've seen big crowds out front in the clinic here and PT, so we're rolling. Overall, year to date, 73,343 encounters, an increase of 6,712 over the previous year. Next one, gross patient charges. For April, it was $4,037,000, an increase of 1.9 over last April.
But it did fall off on March.
Yes, and year to date, that's the difference too, is that year to date at 39 million is just decrease of 2 million over this time 2020. But I think what this time 2020 was the start of COVID and building up where this whole year has been in COVID. So I think we'll surpass it here in the next 2 months for sure, once we report May and June. Moving right along, collections. Collections for April were $3.36 million, an increase over last April of 250,000. Year to date is $23,620,000. It's a decrease of 641 over 2020. Once again, we're confident we'll surpass that.
How'd the move go for the billing office?
Move went well. The business office is located now in the 2020 building. It took just a day. But now they're trying to settle in and get the new routines going.
But all the connections were in place to connect to your systems.
Yes. It took an extra day to make sure that all the printing, because there's a lot of different components of that. And then we also have computers that the offsite people use. So when they're working offsite, what happens is they log onto a computer here. And so they're, even though the computer's here, they're at home working. So we had to move those, and sometimes they have to print, and we have to reassign those offsite printers that have been sitting in a room up in the second floor of the EMS room with the backs turned so you can't see what's happening. Keep it HIPAA compliant. So we have to make sure that we move those, get that all set.
Did we move the durable medical supply also?
We have not. So the big challenge that we have there is in order to make it work properly, we have to have a new entrance. The door that was on the southwest corner of the building had steps, so it's not ADA compliant. So what we ordered is a new door, is ADA compliant, and it opens both ways, so it's another requirement. So it's large enough, but the door has to run. And we can't get clear definition when the door will get. It could be a week, it could be a month, we don't know. And Basin Glass that is saying, this is a problem they're having everywhere. It's for metal doors, and it has to be the appropriate kind of door. So we can't move that until the door gets here.
Is everything else kind of ready? Fine.
Everything. And has been. As soon as that door, and we have signs up saying, please pardon our delay, but we're waiting for that door. We still have the office available where it's currently located, block away. And as soon as that door gets in, we'll look and install it, and then we'll be ready.
All right, days cash on hand, 103 for the month of April, which you see is, compared to March of last year, we nearly doubled it. Part of it is the settlement, or the Medicare, that made it bump up about $2 million, or so on the balance sheet.
So that's the cost report. So everyone remembers, last November 30, when our cost report was done by Whitford, we actually got the report in February, but the cost report itself was filed fairly soon after, in December. It called for that cash. Now, we didn't get the cash until this month. So the federal government is quick to ask for the money, not so quick to give it back.
Mike, that's a record right there, so congratulations. We like it. Yes. It's like the good old days.
Okay, for the monthly net income for April was 4.038 gross revenue, less the revenue deductions of $746K, as you see over there, less expenses of 3.1 mil, which resulted in a net surplus of 232.
I like your new format.
Yeah,
Can everybody see this? Okay.
Yeah, I like the size too. Yes, much better, thanks, Ed.
and then, I'm sorry about this one then, in advance, but, and since we just talked about the profit and, or the monthly net income, the profit and loss, basically, I'm more focused on this side on the year to date, which is 29 million in revenue, less expenses of 32.1 million, less the non-operating plus the revenue of 878. Gives us a negative for the year of 2.031 million.
And a different color background on year-to-date may make those numbers stand out a little bit better at this distance.
Okay. That's everything. Yeah, and there wasn't too much. Okay, balance sheet, my favorite part. Cash saw an increase at 2.718 million. Plus you see the huge decrease in receivables, and that's all part of that cost report. The other piece to remember that the total assets are 59,193,000, total liabilities of 48.6 million with a fund balance of 10.58 million. I'm just trying to go on record for later on, make any adjustments. Now, the next thing we had on the agenda.
We do the resolution. We have
Yes.
budget resolution, 2021. So,
Did we send that out to everyone? Did everybody get a chance to see the resolution? sorry. We have that resolution and would you like me to read it out loud for you? Would that be helpful?
You might just make a little summation just for the audience on the camera.
Okay.
Sure, and basically this is the resolution adopting the budget to make appropriations and categories and levy taxes. If you can scroll down just a little bit, Charlie, just to point this out, these are just taken right off the published budget that we presented previously. The only difference is in the capital outlay, where that was reduced per your request.
Keep going down to that.
Yes, so what we want to have happen
Capital outlay, you go back up.
So that would total 2.5.
So what we want to do is two things. One is ask you to approve the budget that was approved by the budget committee. And then the second thing is once you've approved that, you approve the resolution, because that allows us to do the general obligation and general fund issue that one. Those are the two things we need to do.
Okay, then, Don, and I would so move that we would, we have to do the last, with the budget.
First one is the budget.
First, yeah,
Yes.
okay. That we approve the budget that was approved at our budget meeting of whatever date.
That was May 20, May 30th, excuse me.
And we'll vote on that one and then do the other.
Yes, let's go ahead. So we've had a motion to approve the budget as approved by the budget meeting on May 30th, 2021. All those in favor?
Aye.
Aye.
And I'll second.
Yes.
And John, sorry. We don't have time for all that.
That was the budget committee.
So it's moved and seconded and approved unanimously for the budget of May 30th, 2021.
Thank you.
Okay.
Second is the resolution.
And then the second is to approve the resolution as presented here tonight.
I so move that we approve the resolution that Charlie has on the board here. Is there a title to that at the top or something, Charlie?
Yes.
21.
Resolution 2021-3.
I'll second.
Just so that you know the numbering, it's the third resolution the board has taken this year.
Okay.
So that's how that numbering system works.
Okay. It's been moved and seconded to approve the budget resolution 2021-3 for the upcoming year. All those in favor?
Aye.
Opposed? Hearing none, passes unanimously. Thank you, Charlie. We're going back to Ed now with the GLIMS, Goose Lake Medical Services.
Can we get that for you?
All right, for Lakeview Gardens, P&L, the revenue was up 10,000 in April to 253,391. Expenses were down about 44,000 in April to 367, but still operating at a deficit of 114,131.
I got a question. What does ALF stand for?
Assisted living,
Oh, assisted living.
inpatient LTCs, long-term care houses.
And we're still restricted on getting people into the assisted living, as I understand.
Have we added any in the last?
Oh, we're admitting people in all of the houses, yes.
Okay,
We did have 1 2-week period because of one positive staff member case that occurred that the state would not allow me to admit. But that's the only time recently that that's happened. So,
okay. Thank you.
And I think Rob will get more background on this when she gives her presentation. So.
Oh, finances is all you. I'm a nurse, I do bills, not bills.
Okay, and then the next one is Lake Health Medical Supply. Biggest thing here is revenue was up, from 39, or the total was 39,663, which is about an increase of 6,000 over March. Expenses were down to 31,679, which is from March of a decrease of $10,000, which resulted in surplus of 7986, which if we stay on track for May and June, we'll break even.
Hopefully, now that we're in a new, nicer facility soon, it will start increasing.
So a couple things about that. The facility is really not the driving factor for volume. What drives that are a couple things. Number one, our sleep lab. And our sleep lab has had some ups and downs largely because of staffing. We have two people that can provide sleep lab service. In our waiting line, when we didn't have two, we only were down to one. We got up to 3 months wait time. So when people have a sleep study, then oftentimes they need to have, it's called a CPAP machine placed on them to help them in breathing. And the medical supply business is in the business of providing the oxygen and those masks, amongst other things, to a lot of patients. So that's a big driver for this business. You will recall that we had, we struggled with trying to get people to wear their CPAP machines. And so we engaged a respiratory therapist to help fit those masks. And we had somebody on staff, and that was sort of working, and then that person left. So we now contract with a respiratory therapist out of Burns, who comes here. He is licensed both in Oregon as well as California. So he's able to provide that fitting service for a lot of people.
So he comes down like once a week or something.
I'm not sure of his schedule, the function of, he tries, because it's a distance, he comes when he can, and how soon patients need them. And then they're able to fit and make sure that they get their masks. And we follow up with providing the oxygen, the equipment, and all those things. So those are really the factors that help drive this business. Our consultant has estimated that once we hit $30,000 in revenue per month, we'll start seeing a positive bottom line. And you're going to see that. We have had the need of having this consultant a little bit more this year than we expected. We also kept him on during this transition location-wise, because when you do that, Medicare gets very concerned whenever a medical supply company moves, because other places it is an indication that when they move, it's because they ran out of money and they're going to run away from their responsibilities. So they look for making sure that that doesn't happen. We're not running away, clearly, just moving a block away, so I don't think it's a big concern, but he wanted to make sure it helped us go smoothly in this transition process.
That's a great 1 month turnaround.
It is. We also picked up, we changed our billing software, and we also then changed, I think I told you a couple of months ago, some software where you can use facial recognition for masks fitting, that sort of thing. So there's a couple things that were expenses for this year that we won't have going forward. So that's, I think we're gonna, and hopefully we will see going forward what we talked about when we started this. Better service for our patients and a profitable addition to the service.
Okay, Ed. All right, that's all I have.
Okay, thank you, Ed. Okay, Rob, you're up.
All right. I'll keep it fairly short and sweet, but I did want to make myself available to you because I know that there are questions, and with everything that has happened in the last year with COVID, there have been so many changes that everyone's confused. So first of all, I'll talk real briefly about some of our quality measures and things, which, yeah, that's the next slide.
Go on to the next slide.
Yeah, please, thank you. These across the top, the columns you'll see are all areas that are quality indicators related to care. They're things that CMS care very much about and surveyors care very much about. They indicate whether or not we're doing our job well in the care we provide out there. So I track things like rates of falls, weight losses, weight gains, antibiotic use, acquired pressure ulcers. I've added COVID testing this year for staff and residents, something I didn't used to obviously deal with. And we also, since January, started incorporating the number of COVID vaccinations in with our other immunizations that are tracked for infection control purposes by the CDC and CMS. We have had occasion this last month, we've managed to, I now have one person with one alarm left, fall alarm left in the 2 long-term care houses. The rest are history. They're gone. And we're doing better. They're doing better. Stop and think about having some squawking box behind you. What do you want to do to try to get away from that thing? Those things were causing more problems than they were curing. We're finding better ways to prevent falls, plain and simple. And a lot of that involves person-centered care, more consistency. As much as I can provide in staffing assignments is helping. Unfortunately, we do still have a lot more of the temporary staff and contract workers than I would like. The good news is, and Ken can attest to the fact because he helped us do some interviewing, we've got a good batch of potential candidates for our NA
I was
class.
impressed with the quality.
So we'll see how that all works out, but hopefully there will be even more consistency and continuity to be had because we'll be able to have some more of our own people instead of, and there's nothing wrong with their skills, but
Rob, just help me out, what does some of these APU, what does that mean?
acquired pressure ulcer, a pressure ulcer that they acquire after they are admitted into our facility.
And what's an HCAI stand for?
Healthcare acquired infections. You'll notice, you see the dark blue column that says antibiotics.
Yeah.
That's the number of antibiotic prescriptions given to all the residents in the long-term care in that month. Now compare that number to the healthcare acquired infections. Those are the numbers of actual infections that meet the definitions per the CDC of a true infection. And the reason that those things are important, I'm sure you probably maybe heard the hot button buzz thing that started a few years ago, antibiotic stewardship. Overprescribing of antibiotics became a huge issue, really brought to the front and started to be looked at very hard a few years ago in long-term care. And so the CDC said, hey, this is what a true infection is. Why are we giving antibiotics? We're creating resistant organisms. So it's a way to help track our antibiotic use versus what is considered by definition a true infection. Okay?
Question on the census. Total capacity, are we
24.
36?
This is just for the long-term care
Okay,
houses,
thank you.
so 24. Yeah. I have a separate metric that I keep for the assisted living, but because we're operating on different sets at state and federal regulation levels, I keep separate, I don't intermingle the
So if
two.
our maximum occupancy in long-term care is 24, we are in May at 20?
We are now at 20, yes, we've had a couple of our, well, one was a fairly new admission that passed away a couple weeks ago. A couple of our long-timers have gone on here in recent months, so it's brought us down a little bit. Working to take what admissions and referrals we can. Took one today for tomorrow in the ALF, but it's because sometimes it's a waiting game between Teresa's floor and coming to me.
Yeah.
So
How many are on Medicaid?
I have 5 private pay, everybody else is Medicaid in the long-term care houses.
The big problem is our state doesn't pay well. mean, they're really hard to get. When we have patients that really need to go to long-term care, we have a very difficult time getting them paid for.
You fight tooth and nail to get the case managers to approve them for the benefits so that their services are paid for. Or even say that they qualify for long-term care sometimes. And it's
If we were in
ridiculous.
California, she'd be twice as full, because that many more
Easily.
people would be covered.
I would be in back home too.
A question for Charlie on that. Is that through EOCCO?
This is all directly through DHS. EOCCO, the CCO, which is the Organization for the Medicaid Population, that's really for the working population. This is a different component of it.
Yeah, there's community Medicaid, which is what you have when you're still living in your own home and you use Medicaid to cover your doctor bills, your prescriptions, etc. It's a different form of Medicaid for a long-term care facility.
And it has to go through an approval process.
Yes,
with
there's
the
case
worker.
management, the DHS worker has to evaluate the individual to ensure that they feel that that person's needs qualify them to need a long-term care and therefore for the state to need to pay that long-term care. Rather than somebody just doesn't want to live at home alone anymore, but they really don't have any medical issues or need for assistive services, Medicaid's not gonna cover their bill. So they're trying to not waste Medicaid dollars, I guess, is the best way to put it.
Rob, what is the
Yes.
time frame from like the interview process you just had until being able to put somebody to work?
This next CNA class is getting ready to start next Friday. They will be done through their clinicals at the end of July. And at that point, they will either go to work as uncertified aides for me until they can go take their state test. They have to pass their test. I can only have them work uncertified for 4 months maximum according to the state and federal regulation.
Some may also go to acute.
And
too.
some may, yes, and some may well go to acute as well.
So,
But
if
they
they
can't
pass their
work in
test,
acute till they're
They,
certified.
yeah, they have to be certified before they can
then
go
they
to,
become a CNA?
yes. Yes,
Certified nurse.
assistant, yeah.
So that certification is the difference. That's the difference between a certified nurse assistant versus a nurse assistant. And once they finish the class, they're nurse assistants.
But they have to take past the test.
Yes,
Then
they have to be
They have 4
certified.
months to take the test and become certified. Or do they have to then take the test again?
Yes, but I cannot continue to let them work past the 4-month mark until they pass the test. So if they go on, the last day and then they don't pass, I can't schedule them to work until they go, and they would have to schedule and pay for that, go to plan and do it all on their own at that point.
So we encourage them to take the test quickly, pass it quickly. And if not, give themselves enough time to study up a little bit and pass it again when they take it.
As far as other things, I'll tell you about real quickly, just so that everyone is aware. Right now, my long-term care staff, we have 65.4% of our staff are vaccinated. Unfortunately, while that affords us some leeway and some lightening of the regulations that we've been under, it does not get us out of things like if you were to come visit the houses, you would see all of my staff wearing either a face shield or goggles. That is because we still have enough vaccine hesitancy among staff members that they do not meet Oregon DHS.
What's the magic number?
Magic number is that we would have to be at 70% of our staff as of May 15th,
You're
75% by June 30th.
close.
If I could come up with that other 9.6%, John, I would love to. I really would. The better news is that as far as our residents go, we're at 99.5% as of today. I have one unvaccinated resident out of 20. And I have none that are unvaccinated at the assisted living right now. Their staff percentage, I believe vaccinated is 44.some odd % there. So We are allowing visiting out there, we are taking admissions. I am going to, the way the CDC and CMS so highly overregulate long-term care and assisted living, I have to follow their numbers and guidelines and metrics. This week is the last week that I will have to be testing all of my staff twice a week. Next week, we will be starting to only have to test the unvaccinated staff, even if we have another positive case come up. So that's a step forward. As it is, we've been testing people, just, it's crazy. Well, I myself get tested twice a week, everybody that goes in the houses does, because that's the current guideline.
You still do the call then to visit?
For right now,
Or,
the call ahead, yes, because the visitation, guidelines that CMS has state that in long-term care, I can have no more than 20% of my residents having visitors in the house at one time, which means if I've got 10 in the house, only 2 of them can have a visitor at the same time. We've been doing this ever since they allowed us to start back toward the beginning of the year, letting visitors in again, even on a limited basis. We've only had one scheduling conflict. Families are really good about it, you know, and if we have to say, can we work something out for a half hour here, they work with us great, and everybody's been happy with it so far. They can visit outdoors, or they can visit in the resident rooms. The regulations right now will not allow us to have, if you want to go eat dinner with mom, you can't do that right now. Or be visiting in the common area where if you came to see your loved one, you would also be around other residents. Because we do not require vaccinations and don't have to for the state and feds of our visitors. So that's part of the reason. Okay. Are there other questions, other things that you guys want to know about?
Yeah, you mentioned that, though. So long-term care has a max capacity of 24 and we have 20. What does the long-term care have as far as capacity? So
Assisted living.
Where are we on the
Oh,
assisted
assisted living has,
Oh.
okay, assisted living has capacity of 12, we will be admitting number 8 tomorrow morning. So, although unfortunately for her, but unfortunately for our census, we do have one that's going to be able to discharge home, here in the next week and a half or so. So, yeah, it is very good for them, but we'll continue on the hunt, and I have referrals coming in. I try to keep a bed or 2 open, you know, in long-term care and one in the ALF for when we have people come in to swing bed, people from the community. I look at those first before I look at outside referrals, or at least people that at least have family in this community, so.
Thank you.
Appreciate that. Okay, surplus items, Ed, you're back up.
Okay, so this is, in regards to, some Omni cell carts, they were purchased in 2011. They're fully depreciated and they have no usable value to them. So we would recommend that the board approve us to dispose of them.
what is it?
So did you also, okay, so you probably don't know what an omni-cell.
That's when you had the picture?
Yes.
Yeah.
Trying to get that to come up. Okay, so this is the computer.
That's the EKG. That's a
That's
stress
the wrong,
test.
there's,
Yeah.
stop that.
Slow down.
No, that's what I'm trying to do.
What does that do?
So this beast is found in our medication room. What happens is when a nurse gets a prescription for the doctor, that the doctor wrote, is going to go and get that medication. They go in and log into this computer that's in the locked room. And then they enter the patient's information and who they are. And then a drawer becomes available for them to take out that medicine.
Actually,
There's over
the fingerprint.
Well, now the new one,
No, we could on this.
on the old one too?
Yeah, we could just touch it with a fingerprint. So this is for acute. So we just touch it and then we enter the patient, name, you just have to enter a few letters and select the patient, and then, select the med, and boom, the drawer opens.
It's a pill ATM.
That's correct.
Yes, it is.
Pretty much. Could we use it for a gumball machine?
Not this one.
But
No.
it's super safe, like it helps us with safety because it controls the access to, down to just that drawer. And then, it records what you're taking out and keeps a really close count on all of the meds
So
that
this
we
doesn't
get.
work anymore, so we're getting rid of it, or what?
It wasn't, I think it had to do with, it wasn't communicating with the newer software now.
So when we
Now
went
it's
to
out of
CERN,
date.
when we went to CERN, this has met its life expectancy. And the software would not work well with the software CERN and Omnicell, the company's software didn't work. So we have new Omnicell equipment. And Omnicell was happy to sell us the replacement. And we did that about a year ago, and they finally came in. Now, we need to, we can't sell them. No one wants to buy them because it's not worth the software maintenance. So Omnicell will be happy to take it back and they'll use it, I'm guessing.
So then they, in essence, will dispose of it.
They will just go down.
That, yeah, I did see the letter that they indicated there was bill for that.
During this period of changing our computer system and not being compatible, how did we manage our drugs during that period of time? Was there not an overlap?
Well, it was working, just not well. We still had them in, we were using this up until the time the new one came. So,
It wasn't as fast, it was clunky. The new one, the new system works like a champ. And Omnicell would very much like to sell us one for the long-term care facilities. They'd like to sell us one in the operating room. They'd like to sell lots of,
They're in that business.
pardon me?
They are in that business.
That's exactly right.
So then there were two other items, Charlie, on the surplus list.
The EKG equipment.
That's it. You got the Omnicell and two other items on your list.
No, I don't.
So those two other items are it's the Omnicell and the EKG machine that we have. Right?
So what is the question before us?
So
We need
what we
to-
need, so the rules are, these are public funds purchased this. In order for us to dispose of them, we have to have board approval to declare them surplus. Once you declare them surplus, then we can take them off our books. Otherwise, there's an opportunity for us to let somebody else in the public have it. And that's against the law. So we're careful to make sure we indicate what needs to be declared surplus.
Surplus of public property.
Surplus of public property, correct. That's what, okay. So we request that you make those items surplus.
So moved that the items presented be declared surplus.
Second.
Moved and seconded to declare the surplus items as presented. All those in favor?
Aye.
Passes unanimously. Okay, Dr. Foster is not here.
Dr. Foster was unfortunately tied up and couldn't be here. I hope we have sent this out to you.
You did, but often they're already signed, and I noticed that the ones that were sent are not signed.
We need to send Dr. Foster would be here, so sign it in advance or before you. These were approved at the last meeting. Dr. Clark and Lindsay Clark, they're both dermatologists that will be joining Dr. Wisku medical staff recommends that you approve these two applications.
That's a move.
Second?
Been moved and seconded to approve the medical staff privileging as presented. All those in favor?
Aye.
Aye.
Okay, passes unanimously. Teresa, you're up. Nursing report.
All right. Well, Charlie and I have been going through potential candidates for my replacement. I can tell you there's lots of them, lots of candidates. We are still kind of working through some of the initial phases of that. So hopefully we'll have more information in another month. I can tell you that acute has been on divert. I think we've talked about that before, where when we reach a level of number of patients or not adequate staff to care for the patients that we have, we go on divert, which means that we try to transfer those patients out to another hospital.
But aren't they also full?
But there you go. John said the problem, which is that other hospitals are also full. Some of the hospitals we know in Bend, they have, 10 or 15 patients waiting for beds in their emergency room, even caring for patients in the hallway. So it doesn't make it easy for Lake District hospitals to transfer patients out, even those patients who absolutely require a higher level of care. We have been evaluating every admission individually and doing the best we can to get through what has been an awful lot of busy months. We've had busy months. So the nursing staff have been working overtime routinely to care for the patients, but technically we're still, as of today, we went on Thursday and we're still, as of today, still on divert. And probably will be through the weekend. Again, partly because of staffing. Technically for our average number of patients, we have enough nurses, but as Charlie and I talked about this week, we'll probably have to increase that number of nurses just to increase the level of staffing that we have for a higher number of average patients per day.
Have we been full in rooms?
In the rooms?
Right, the rooms.
We have had usually 1 or 2 beds available. It kind of varies with what's going on with each patient. And we've had this, in the past week, we had more OBs than we had rooms for, so then we have to move those patients out on. The patient who's delivered the longest goes out on the floor. So we've had that going on. May is going to be a lot of babies born in Lakeview.
June.
Or excuse me, June. Yeah, I don't know what
We're in
month it
June
is.
now.
Thank you. So that's just a little bit about what's going on. We've also made the commitment to try to provide a little higher level of intensive care nursing to our patients. So we've started training for some of the more critical drugs and procedures that are done. We haven't done them at Lake District Hospital in quite a number of years. So we're increasing that training so that we can keep patients that are a little sicker for 2 reasons. 1, sometimes we can't get them out. And 2, because some of our physicians are wanting to do a little more, keep patients that are a little sicker and care for them ourselves. So that's a process that we're undergoing. I can tell you that we have a new cardiopulmonary manager that will arrive toward the end of July, so it's a little over a month away, that will be assuming supervisory job for respiratory therapy, sleep lab, pulmonary rehab, cardiac rehab, and sleep lab. So
And that's something you're doing currently?
that's something I'm doing currently, yes. And then we've made some changes in infusion. Infusion services have been provided primarily through our surgery department staff, and we've pulled that out of that area, and they are going to be reporting to our ED manager, Abby Finetti. So, we're making some changes. It's probably not that visible at this point, but we'll hire a nurse specifically to do infusion and some of the other outpatient treatments that we do, nursing treatments that we do. So I'm looking forward to seeing what happens with that when it gets a lot of TLC and attention. So we're hoping to grow that particular area and provide more of those services locally. So any questions for me? Issues?
Just one little clarification, you said something about moving patients out on the floor. Just
What's the floor? Yeah,
Yeah.
what's the floor? Yeah, this is the floor, don't you? I'm sorry.
That's the ceiling.
I'd just like to make sure our public understands what we're doing.
So the floor is my nursing word for the acute care department instead of the OB department.
Okay.
Thank you.
I'm just very conscientious of what our bosses interpret.
Yes.
So Danielle, please don't report that we're putting people just out on the floor.
Yeah, I'm glad that you guys clarified that, because that was gonna be my headline.
I knew she was coming.
Thank you, Lisa.
Thank you very much. Okay, next item on the agenda, CEO report.
Thank you. Before I do that, I wanted to see if Rebecca had anything that she wanted to add.
Well, going back to the NA program, we had a total of 15 applications, which was stunning.
That's way better than before.
Way better than we've ever had in all the years that this has been going on. We ended up selecting 12. However, we're waiting to hear from KCC as to whether they will accept 2 more in the class. I did get an email this evening, which I've included Teresa on, that we're gonna consult about and see what we can do to get 12 total in the classroom. So if we can, that will be great, and if we can't, then we'll have to stick with 10 and defer the other 2 to the next time we do this. So I'm very hopeful, Ken was able to come to the majority of the interviews. That was a huge help. I felt like we had one of the best candidate pools that we've had so far. I looked back at long ago applications, and it looks like this was just the best all around.
Great.
So, yeah, so I'm very hopeful. And I'm hopeful that they'll all accept and commit to it, and then, you know, get down to the studies and pass everything. So I'm quite pleased. Thank you.
Thank you. So, a couple things that have been happening, and I'm working toward that speedy board meeting. So first off, we do have a new website. If you haven't seen it yet, take a look. It is been a long time in coming. Please provide us with any of your comments or suggestions, because we're able to make some adjustments that we weren't able to in the past. There are essentially 3 things that I think about when the public anybody comes to our website. Number 1, they come to find out a little bit about who we are. And that's generally what people do. Second, they apply for a job. So we've got to make sure that it's really simple in our process. And sometimes we've struggled with that. Now the process is directly through our Chronos software, so it makes it much easier for someone to apply for a job. And when we first started websites, keep in mind that most people did not use a phone. Now it turns out most people use their phones to look at websites and apply for jobs. They don't use the desktop as much as they did in the past. So we had to make sure that it all fit properly for them. It's got a fair number of different components. And then, of course, the other part that people look for is if they want to pay their bill. So we're going to make sure that that component works well. And so all of them are working well, and additional information want the public to know about is better than. But if you go and look and you say, I don't think this makes sense, or it's hard, or whatnot, please let us know. Don't be shy. The next thing is we're about to start the summer lunch program. We have been doing the summer lunch program, I think for 5 years, 4 or 5 years at least. So this was a program that was done in part by another agency, when the daycare program, not daycare,
Head Start.
Head Start, thank you. Head Start was doing that, but when they moved to their new location, they didn't have a kitchen set up, and so we got involved, and we've been doing it since. We continue to exceed the number of meals that we provide to kids in the summer each year. So it's a wonderful program. We've tried to offer it in Paisley, in North Lake. So we're trying different locations. And some areas we find predominantly here at the kiddie park or at the swimming pool has been best. So.
Approximately how many do we serve?
Sometimes we're up to 150 a day. So it's a lot of meals. And our staff makes the sandwiches, makes the bag lunch, if you will, and prepares them. So it runs the gamut. Sometimes, depending on, it starts off big. Some years it started off big and then waned toward the end of the summer. Others it stayed consistent, and others it's actually increased. So it fluctuates. I'm not sure there's a clear answer of what the volume is, but it keeps getting more each year, which is a wonderful thing. We started another program that's kind of an interesting thing. Are all of you aware of Amber Alerts? So what we now have is we have the software in Lake County that we supported. Not only do we have it, but available to other emergency service responders, to where we can send out an alert to all of our employees, or all of the set type of employees. Say we needed all of our ambulance people, or we needed all of somebody. We can now send out those alerts specifically to people within our staff. We're now testing it more frequently. We just finished another test and make sure that everybody can get it, everybody's familiar with it. Not that it's an Amber Alert, but it is something like that specifically for Lake County. That's a really positive thing for helping us to be prepared in the event of challenges that we all want to come together and work on. So that's good. We had our lab inspection last 2 weeks ago, and it went well, and no major concern. So we are anticipating that we will be inspected by the state for the hospital, possibly for long-term care, possibly for mental health. Not all of them are not announced, they just show up. It's been several years for several of them. This last year they didn't come out because of COVID. So we're anticipating that we will have more surveys this summer. And you can also imagine that people from the west of us have a hard time crossing the Cascades during the winter, so they like to do this summer. So we expect that to happen. Our COVID update. As you can see on the board here, we have 3 active cases currently in the county. It's significantly less than it has been in the past. If you've been tracking how the numbers of cases, the numbers of hospitalizations, all of that has been waning. There are some pockets where it is still a grave concern in the greater Bend. Their hospital has had a tragic increase in the number of cases, and that's been difficult for the hospital as well as the community. But it has not affected us as much.
The 3 active, are they hospitalized or they're just, no one's hospitalized?
It didn't say that. There are 3 active cases.
Okay.
So we have had patients that have been hospitalized. So throughout the last year, and we have had people who have expired because of COVID has impacted their health. It's caused them to die. Our vaccination rate, we continue to have the least amount of vaccinated people per county in the state.
Per thousand.
Right. We're at 33.8% as of today. I hope that there will be some incentives on the part of those that, when the governor has announced that there's a lottery for people that have been vaccinated, so they'll be giving out $1 million for all the eligible people that have been vaccinated. And then, of course, for all of the counties, there will be a $10,000 lottery winner from each county. So those people that have been vaccinated, included, are eligible to win the $10,000. And that, I think, will take place the latter part of this month. I am hopeful I'll be a winner. I'm not holding my breath, but I think that if others think that it's a possibility of getting that $10,000, maybe they'll elect to get vaccinated. I don't know.
How does the state track names to know who to, how do they know my name's on the list so that they can give me the $10,000?
It's a simple answer. When you got your vaccination, public health or whoever the nurse was, they tracked every single person.
That would be through the Veteran Administration out of Klamath Falls.
No, it's a statewide program that every vaccination center used and continues to use throughout the state.
I just want to make sure I didn't slip through the crack on my $10,000.
My guess is that your name did not slip through the crack, and that lots of people are saying there might be times that you need to have a vaccination card to get on a plane or to do certain things. If you might have misplaced your vaccination card, public health will be able to access their computer database, pull up your name, get the dates of when you got your first and second shot, provided you got both, or with the J&J if you got the one shot, and we'll be able to reproduce that card for you. So it's well tried.
Ken's trying to get his name in twice.
Hey, if you need to get vaccinated twice, that's always an option, but I don't think that you will get in the long run. Just saying, I don't know.
If you don't try, you don't get it.
We are, as you have heard me talk in the past, we are interviewing and talking to lots of people about jobs here at the hospital. We've had lots of people, managers and whatnot, that have said they would like to try something different or for whatever reason are looking to move along. We are also looking at additional practitioners. Dr. Chen has been here, Dr. Jeffrey Chin, for now, this will be the end of the second 2-week period. And he's got lots of ideas, he's picking up lots of patients, and it seems to be working well. We were set to interview a midwife in 2 weeks. That looks like it will get postponed for a little bit to work with Dr. Tan and our other family doctors to sort of help balance with the increase in obstetric patients. So we're working on that amongst many other options. Last but not least, we are in discussions with Klamath Community College to expand their EMS training program and have that done here. So they do have a program that they've been offering people to become paramedics or EMS certified in the Klamath area. They're looking to expand that here. They are very interested in that. We now have opportunities. We have good training centers. So we think this would be a good option. Tyson Lane, our new EMS director, has been very active working with them. There's lots of possibilities.
Perhaps we can join in our board meeting.
Certainly ask him to be
Yeah, I'd like
there. Absolutely. Thank you for that suggestion.
What's his last name again?
Lane. Do you have any questions of me or issues? No longer can I say it's been a slow month.
Just curious about the public health and the schools, as far as we've talked about it in previous sessions. We're coming to a school closure, but for next fall,
We're actively working with the ESD to enable us to have nurses in, or have a nurse in the schools, not only here in Lakeview, but also Paisley, West Side, and Adel Plush. And we did have, before COVID, an agreement to have a nurse there 1 day a week. And then we moved to 2 days a week, but then of COVID, that got put on hold. We are working very closely with Michael Carter as well, here specifically, so that we can have not only nursing services, but have mental health services. We also, of course, have been asked to provide that service in North. A lot of times, the challenge is not just having a nurse present, they have to have a room that they can go to. And the schools have struggled with the space so that you can have a student express their concerns or deal with whatever they have in a private setting. So we have a combination of things that we're looking at. But schools, and we are very interested in having more interaction with students, especially with students coming back. Not in the summer, but next fall.
is there, just food for thought, possibility of when we have the nurse at the schools, if they could interact with the biology class at least once a year or something, just to stimulate a young kid's interest in maybe becoming in the medical field at a later date.
It's an excellent suggestion. We have been very fortunate in that at the school here in Lakeview, Bobby Stimminger has, for many, many years, been a very, very strong proponent of the medical world and has provided students with lots of opportunity to come. We try very hard to work with her and the school to give students opportunities to come, spend a little bit of time at the hospital, different parts, different clinics, different areas within the organization, so they do get exposed. And it's been wonderful. Lots of our residents that have gone on to become nurses or other skilled people within healthcare are a function of that beginning program that Bobby has started.
And she still does the medical terminology class.
But we could add EMS into that group.
We certainly can.
Yeah,
That's
I think that'd be interesting.
That's an area that we haven't had as one of the rotations.
So it's a great concept, and we'll be working on that this summer. But yeah, we do try as much as we can to connect not just with Lakeview, but with some of the other schools too. And of course, in Norfolk, wherever possible.
Any other questions for Charlie? Okay. Hearing none, we'll adjourn to executive session under ORS 192-616, bracket 2, bracket A, personnel, bracket C, medical staff, bracket B, real estate, bracket D, legal. We'll take a 5-minute break.